Okay, so the first things that I want to draw your attention to is I want to point out the muscle groups that run down from your pelvis down your femur. There's a couple of main muscles that you can use as landmarks to find all the rest of the muscles that go around your leg. So I wanted to point out the gracilis, which runs inside the inner thigh here, all the way down from the pubic tubercle down to the medial tibia line, and also the iliotibial tract, which runs from the top of the crust of the ilium all the way down the outside of the thigh, all the way down to the tibia, the lateral anterior tibial condyle. And then the Sartorius, which runs from the top of the hip and then it crosses over the femur. It does this diagonal zigzag and it ends up on the inside of the leg. It starts on the outside and ends up on the inside. So we have one just on the inside of the thigh, one that runs directly on the outside of the thigh, and then one that crosses over from the outside of the thigh to the inside of the thigh. And if you start with those and are able to recognize those, then you can use those as reference points to find the rest of the muscles around the leg. So let's start with that, okay? First, I wanted to show you up here. This is the iliac crest up here. So here's the iliac crest, and this is where the attachments for the iliotibial band, the iliotibial tract, which is the first thing I want to point out for you. If you turn this around to the back of it, you can see the iliac crest is still on the top up here. It runs back and forth. There's a little outer lip. There's a little outer lip of the iliac crest, and it runs, let's see if I can get a better, there we go. Here's the iliac crest. There's a little outer lip of the iliac crest, and right here there's a tubercle. Right behind the tubercle, the outer lip runs right through it, and that's on the posterior part of the iliac crest. So the iliotibial tract starts right here and the origins are right here in the iliac crest up here on the back. And then let's turn this back around to the front. So it comes from the back and it goes all the way down the outer side of the thigh, all the way down, and it ends up down here on the tibia of the lateral condyle, and it's on the anterior part of the lateral condyle, which is called Gerdy's tubercle. There's a little bitty tubercle. Now remember, tubercle, tuberosity, and trochanter, all those T words, those are all places for a muscle to attach. So a tubercle is just a bump with a rough bump on the bone, and that's where a muscle attaches, so that's what they call it, a tubercle. And that tubercle is where the iliotibial band inserts. So that's the insertion point down here. So if we put the layers on this skeleton, there we go. Now see, these are the outside layers of the skeleton, and you can see on the side here, up here at the iliac crest, is the origin point for the iliotibial tract. Here's the iliotibial tract, this whole thing in green. It also comes back here and comes up here, but its origin point is up here at the iliac crest. And then these sections of the tendon are part of other muscles that come in and merge with the iliotibial tract as it goes down your outer thigh. Let's turn this to the side a little bit so you can see it. Here's the side of the leg. Goes down, 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 and then you can't really see right below where it cuts off there. You can't see the anterior lateral tibial condyle where it inserts. We'll show you that section of the knee in a minute. So that's the iliotibial tract. Now, over here on the other side of the leg, on the inside of the thigh, there is a muscle that starts up here at the pubic tubercle, and it comes all the way down the inside of the thigh, and it attaches down here in the median shaft of the tibia. So these muscles don't actually attach to the femur at all. They just start up at the pelvis and the hip bone, and then they run alongside the femur, and they actually attach down here at the tibia. So this is the gracilis, and this is your inner thigh muscle. It runs all the way down. And if we take all these muscles away, we can see, let's turn this back to the front. Here's the front, and if you look right here where the pubic symphysis is, here is the, let's see, one more layer. Here is the pubic tubercle right here. I just made green. Just again, a tubercle is just a little rough bump where a muscle attaches. And it's right here, right where the almost where the pubic symphysis is, at the edge of the tip of the pubis, where it meets the other half of the hip over here. And it starts here, and then the gracilis just goes down, 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 down the inner thigh, and it attaches down here. It cuts off the page, but it attaches in the medial shaft of the tibia. Also, I want to point out to you the Sartorius, and the Sartorius hooks up, it originates at the anterior superior iliac spine, and the little notch right underneath there. So this is the anterior superior iliac spine. Remember, if we turn this way, you can kind of see how the spine sticks out there. That's the superior. Here's the inferior. But we want to look at the superior right now. It starts at the superior iliac spine. The Sartorius comes down on the outside of the hip, but then once it gets down to the femur, it crosses over diagonally, and it goes into the inside of the thigh, and then it goes down and is attached next to the gracilis in the medial tibial shaft down here, and it's cut off, so you can't see how far down it goes. But the Sartorius, once again, it attaches up here at the iliac spine, the superior iliac spine, comes down, crosses over diagonally, crosses over the femur, and comes down here. So let's put the muscles back on this bone, and you can see it cross over. There we go. So see, here's the Sartorius, and as you can see, it attaches right here at the tip of the iliac crest, at the iliac spine, and it comes over diagonally across the femur and goes into the medial side of the leg, comes down, and it attaches in the medial shaft of the tibia. Now, if you keep those muscles in mind, you keep the gracilis. Here's the gracilis, runs down alongside the inside of the thigh. The Sartorius goes diagonally across the anterior portion of the thigh, the front of the thigh, and over here, there we go, the iliotibial tract attaches up here at the iliac crest, runs all the way down, and attaches at the anterior lip of the lateral condyle of the tibia. If you keep those in mind, then you'll be able to use these as reference points for all the rest of the muscles that you need to know in the upper leg. So as you can see down here, we got the tibia, and at the knee joint we have the proximal end of the tibia. So up here would be the condyles. Up here are the condyles where it connects with the femur. And if you look at it laterally is where the fibula is. The fibula is always on the outside of the lower leg. So this is the lateral side of the tibia. So this would be the medial side of the tibia in here. So this would be the right leg. And over here, if you look at this purple area that I just turned green, You can see this is the attachments for the iliotibial tract. So the iliotibial tract connects all the way up at the iliac crest and comes all the way down the outside of the thigh. It doesn't attach to the femur at all. Instead, it bypasses the femur and comes down here to the top of the tibia. So it's on the anterior tubercle of the lateral condyle on the tibia. So right here you see attachments for the iliotibial tract. If we move this down one layer, you can see that this is called Gerdy's tubercle. But I don't think you have to remember the word Gerdy. You just have to know that it's on the anterior side of the lateral condyle of the tibia. You can see here's the condyle right up here, and here's the tubercle right there. If we move this up to a bone, you can just see this little pointy bump section right there. That would be the tubercle, and that's where the iliotibial tract connects. It's an insertion point. Over here on the medial side of the tibia, if you look down on the medial side of the tibia, on the shaft section of it, there's this little area, and it says the attachments for the gracilis. That's right there. So the gracilis comes down, it starts at the pubic tubercle, and it comes down the inside of the thigh. It doesn't attach to the femur, just like the iliotibial tract on the other side, but it comes down on the inside of the thigh, and it bypasses the femur entirely, and it attaches down here on the medial side of the shaft of the tibia, right here in this area. Now right in front of this area is where the Sartorius attaches. Now remember, the Sartorius is the one that attaches up laterally on the iliac crest, and it comes down, but when it crosses over the front of the femur diagonally, and then it doesn't attach to the femur, it bypasses it, and it comes down and attaches right in front of the gracilis, right here in the same area in the medial shaft of the tibia. So if we look down further, there's no real name for this. It's just the tibia shaft right here. And if we look up, we can just see it as a normal skeleton. See, there's no marks of demarcation or anything there. It's just the side of the shaft, the inner leg right there. And those are the attachments for both the gracilis and the sartorius muscle. Those are the insertion points. Okay, so here's what it looks like with the muscles on the bones. So the fibula would be out here on this section laterally on this side. This would be the outside of your leg. So this would be the medial side of your leg, or the inside. And as you can see here, if I turn this around to the side laterally, you can see the iliotibial tract come all the way down the outside of the thigh, bypass the femur, and come all the way down, and then it's hidden under these muscles right here, but it attaches itself right around here, the anterior tubercle on the lateral condyle of the tibia. So the lateral condyle would be right about here of the tibia, and then right in the front would be the tubercle. So the iliotibial tract would come down here and attach somewhere right around here. If we go down some layers, you can see the attachments of the iliotibial tract right there. So as we build up, keep your eye on that area, and that's where the iliotibial tract attaches. Oh, see? Right here. So the end of the iliotibial tract would be right there. Now if we look over on the medial side, we can see down here on the medial shaft the medial side of the shaft of the tibia. This is where the gracilis and sartorius muscles attach right here. If you can see the attachment, here's the gracilis muscles attaching right here to the medial side of the tibia. And then here is the sartorius muscle that comes up, and it's going to cross over the femur this way and then go up on the other side of the leg to the iliac crest where it originates. But this is the insertion point down here. And also the gracilis, which is right behind the sartorius. The gracilis is the same tendon, I think, and it is right underneath here's the sartorius right here. So the gracilis is right beneath the sartorius, so it comes up and emerges up here. You see this is the gracilis. And it's just kind of hidden behind the sartorius right now because they both attach at the same place. And see how it comes around? And here's where it attaches. So there's the medial side of the tibia. So keep your eye on the attachment and see how where it goes away. That would be the place on the tibia where it would be attached, both the gracilis and the sartorius. Okay, so let's draw it out. We're going to start up here at the iliac crest, where we're going to start with the iliotibial band. So actually it's iliotibial band or tract. I think your text calls it the tract, so I'll try to stick with that. So iliotibial tract, the origin is the outer lip of the iliac crest. Now the outer lip is going to be on the posterior side of the iliac crest, but it's going to be right around here. But just if you turn this over to the back of the skeleton, the actual attachment for it is on the back curve of the iliac crest right here. So this is going to be the origin point. And then the iliotibial tract is going to come down, and it's going to come all the way down the outside of your leg. It's going to be on the outside. It's going to go past the femur, and funny enough, it doesn't really attach to the femur at all. It just bypasses it, and then it comes down and it inserts right here at the anterior lateral tibial condyle. So anterior is front, so it's in the front. There's a little tubercle right there on the lateral condyle of the tibia, and that's where the iliotibial tract attaches. So the insertion is going to be the anterior tubercle on the lateral tibial condyle. And remember where the condyles are. The condyles are the smooth surfaces where the bones attach. So this would be where the femur attaches to the tibia. So this would be on the same place on the other side. It would attach up here. It would go around and down. And the iliotibial tract is special because it's not necessarily really a muscle. It's more just a long tendon that muscles attach to, and they sort of attach and hang on for the ride and use the iliotibial tract to attach themselves to the bones. So there you go, on either side. That would be the iliotibial tract. The origin would be up here, and the insertion point would be down here. Now on the other side of the thigh, on the right here on the pubis the pubic ramus, the inferior pubic ramus right here, and the anterior pubis right up here. There's a tubercle right here on right before it gets to the pubic symphysis. This would be the origin for the gracilis. And I always think gracilis graceful, because this gracilis runs down the inside of your thigh, and if you try to stand on one leg, that's the muscle that kind of pushes and pulls and balances you and helps keep you balanced while you're standing on one leg. So I think gracilis graceful. So the origin point is the anterior pubis. And it runs down the inside of the thigh. So it runs down the inside of your thigh, the gracilis does, and then it attaches to the shaft of the tibia. Here's the shaft, and the medial side, so that would be the inside of the tibia, the shaft. It attaches right about here. So it attaches to the medial side of the tibial shaft in the anterior section and kind of in the front. So that would be the gracilis. The insertion is the medial shaft of the tibia. And once again, just like the iliotibial tract, it doesn't attach to the femur at all, actually. It just runs down alongside of the femur and attaches and inserts down here in the tibia. And here it would be over here, running down alongside the inside of the thigh and attaching to the medial side of the tibial shaft right up here, just below the neck of the tibia. Now the sartorius, it originates at the anterior iliac spine, the anterior superior iliac spine, which is right up here. And see on the left side of the patient, that would be right up here. So let's write this here, the sartorius it originates at the anterior superior iliac spine, and it comes down, and then it does something funny. It crosses over the femur in front of the femur. It makes this big diagonal cut and crosses all the way over and ends up on the inside of the leg by the time it gets to your knee. And it comes in and it attaches right at the same point the gracilis does. So the gracilis and the sartorius both, their insertion point is the medial shaft of the tibia. So here it is over on the left side of the patient. The sartorius is going to come down and it's going to cross over diagonally, and it's going to make its way to the inside of the knee, inside of the leg, and it attaches right where the gracilis does, same place. The medial shaft, they're the medial side of the tibial shaft. So the insertion point for the sartorius would be the medial shaft of the tibia. So if you keep in mind these three major tracts, the iliotibial tract on the outside, the gracilis that runs down alongside on the inside of the femur, on the inside of the thigh, and then the sartorius that diagonally crosses from the outside to the inside, then we can use these three features as reference points to know where all the rest of the thigh muscles are at. Now here's the back of the skeleton of the lower leg. So the iliotibial tract, as I said, here's the iliac crust up here, and the iliotibial tract actually connects in the back here, and then it comes out goes down the side of the leg, the outside, and then it comes in and attaches in the front of the anterior of the lateral condyle of the tibia. The gracilis attaches in the front of the pubis on the other side, and it runs down in the inner thigh, and it comes in and it attaches to the inside or the medial section of the tibial shaft. And then the sartorius connects in the front. You're not going to see it back here, but it comes down and it moves diagonally in front of these bones until it gets into the inside of the thigh. It goes from the outside to the end, and it attaches in the same place that the gracilis does. It inserts in the same place that the gracilis does. Now remember, the origins and attachments. The origins, like for example, the origin to the iliotibial tract is the bone that's not going to move when this muscle pulls. This is like the fulcrum point. And then the insertion point, wherever it's inserted, that gives you a clue of the action of these muscles, of how these muscles are going to work. So if a muscle can only shorten, here's iliotibial tract shortening. If the muscle can only shorten and it inserts down here at the tibia, then when this muscle shortens, when this muscle is in action, it's going to pull this entire leg up this way. So it's like you're doing side kicks if you've ever done like aerobics or exercised or anything, and you raise your leg up this way, so then your leg's sticking out when your leg's sticking out horizontally like that. That's your iliotibial band that's helping to do that. Your gracilis, on the other hand, works the same way, but since it's on the inside of your thigh, when this muscle shortens, this is going to and it attaches at your tibia down here. This is going to bring this leg inside like this. So if you're doing a dance move and you're crossing one foot in front of the other, then this is going to be the muscle that's going to help pull your leg toward your midline. And if you use these muscles right here to kind of place yourself or get your bearings on the models, then you're going to be able to find the rest of the muscles with ease.